All right, I'm going to try and do this as best as I can. Sorry if there's background noise. I have a baby trying to sleep, and hopefully he behaves during this. The article I chose regarding motivational interviewing was a diabetic study or type 2 diabetes and arterial hypertension study. That was a double blind parallel group randomized control test that was performed in 2018 and 2019 in Brazil. It was performed in three different health facilities throughout Brazil. And the main difference throughout the study was those that received um, one of the groups received motivational interviewing as their change, and to compare the two groups on how motivational interviewing helped with a chronic condition. Um, the motivational interviewing is a collaborative communication that can help with promoting lifestyle changes and management for type 2 diabetes and hypertension. Of the study was 147 people divided into two groups, and with the change that those in the control group received training from those who had 20 hours of training in motivational interviewing for their nursing consults, and the usual group just had conventional nursing consultations. The study participants, there were people who were responsible for the randomization and allocation, the people responsible for measuring the outcome variables, and those who did the data analysis were all blinded. The interventionists were not blinded because they had to receive training. And then the measure for this test was hemoglobin A1C as well as blood pressure and adherence. Um, Motivational interviewing has shown to strengthen some person's motivation to commitment of change and behaviors in their interest of health on a basis of respect for their own autonomy. It's inexpensive and a high potential impact strategy that can be learned through for many healthcare providers. Both groups received an initial consult of 30 minutes to about an hour, and then they also received supplemental consults throughout that 6 months. And again, the only difference was the motivational interview training. Of the 174 participants, um, at the end of the study, it was found that there was no statistically significant difference in hemoglobin A1C between the control group and the usual group. Um, there was at the end of the study a zero point 0.4 reduction in hemoglobin A1C for those who had received motivational interviewing. However, it wasn't statistically significant. Um, and then there was no difference in the A1C of those in the usual care group. Motivational interviewing group had a reduction of 13.7 systolic blood pressure in comparison to that usual group. And then they also had a difference of a decrease in 5.7 diastolic for blood pressure. So that was statistically significant. And then as a secondary outcome, nurses had done adherence monitoring and reviewing and encouraging patients to go meet with their general practitioner for a consultation. And of that, 60.7% were from the usual care group and 69.7% from the MI or the motivational interviewing group. And so that showed statistical differences as well. The study found that they found differences in the improvement of motivational interviewing group for blood pressure and adherence score after a mean follow-up of 6 months. The 0.4 reduction of hemoglobin A1C levels among participants who received motivational MI or motivational interviewing was significant, especially considering that motivational interviewing was used as an adjunct and part of the care team for diabetes management and the healthcare team. However, the MI group was no more effective than the usual care group in reducing hemoglobin A1C, and that's why it was not significant. The main effect of adherence for the motivational interview group was taking correct medications as prescribed, a healthy diet, physical activity, following up with the provider. For limitations, one limitation is that there was no feedback for the MI interventionists besides their training after their 20 hours of training. So they did not get a follow-up throughout the study to let them know how they were doing with the motivational interviewing. Sample size is another limitation due to lack of patients, the limited time, and the amount of dropouts that occurred. And there was no pilot study or pilot group before this was conducted. And so there was no knowledge if the hemoglobin A1Cs for these patients were within range or out of range before the study. And then depression is another possible limitation or correlation with adherence. Depression was screened when at the beginning of this project, but it can also be a indication of poor clinical outcome and possible confounder. Just to conclude, primary healthcare with use of motivational interviewing as a strategy can help improve blood pressure and adherence levels for those with type 2 diabetes. Um, Even with the limitations of this study, it is hopeful that with the information, it can be used to contribute towards the use of motivational interviewing as an effective tool in improving care responses for those with chronic conditions, um, and used in the future within primary healthcare settings to help transform healthcare reality and raise standards, promote lifestyle changes, and improve quality measures. And yeah, thank you.